Hello, awesome Broward Virtual School full-time students. My name is Miss Baldwin, and I will be walking you through your CPR, AED, and first aid for high school training today. Completing this course will satisfy the mandates of House Bill 157 that requires school districts to provide basic training in first aid, including cardiopulmonary resuscitation, known as CPR, for all students in grades 9 and 11. The title of our course is CPR, AED, and First Aid. It is for students in grades 9 and 11. The objectives will be to describe the important differences between heart attack and cardiac arrest, describe the steps to perform hands-only CPR for teens and adults, perform hands-only CPR for teens and adults, and describe the assessment and first aid actions for bleeding and bandaging, stroke, heart attack, fainting, diabetes, seizures, and opioid overdoses. Our standards for grades 9 through 12 include evaluate how environment and personal health are interrelated, assess the degree of susceptibility to injury, illness, or death if engaging in unhealthy, risky behaviors, explain skills needed to communicate effectively with family, peers, and others to enhance health, analyze the validity of ways to ask for and offer assistance to enhance the health of self and others, and determine the value of applying a thoughtful decision-making process in health-related situations. In this course, we will watch a series of videos that explain what CPR is, what an AED is, and how we can perform hands-only CPR. Then we will watch a series of short videos that explain what first aid is, as well as some common emergencies and what to do while you wait for help to arrive. When we are done, you will need to record a short video of yourself demonstrating hands-only CPR. You will then need to email your video demonstration to your CPR instructor, as indicated in their email that you received. The entire course should take no more than 1 hour to complete. Please note, for your CPR demonstration video, you will need to sketch a rough outline of the upper half of the human body on a sheet of paper to practice on. An example of a student sketch is provided. You do not need a mannequin for your video, even though the training videos that we are going to watch, they do have a mannequin. Please know that you do not need one. Having the piece of paper to practice on is sufficient. We will begin by watching the American Heart Association videos about CPR. They are entitled Course Introduction, Adult CPR and AED, and Child CPR and AED. Then we will watch the videos about first aid. They are entitled First Aid Course, Bleeding, Stroke, Heart Attack, Fainting, Diabetes, Seizures, and Opioid Overdose. Please feel free to pause my video if you need to re-watch any of the content.
It was early in my shift at the cafe, around 8:45 on a Monday morning, and I was still feeling tired and groggy. A customer ran up to the counter and asked, "Does anyone know CPR?" A man had collapsed outside on the patio. Suddenly, I was wide awake. I didn't have formal training in cardiopulmonary resuscitation, that's CPR, but I had learned some skills from the American Heart Association website and from scouting when I was a kid. At first, I was nervous, but there was no time to waste. Somebody needed help now. Outside, the adrenaline kicked in like a shot of espresso, and I knew exactly what to do. The customer had collapsed in a patio chair. I'll never forget his face. It was pale as a piece of paper. He wasn't breathing, moving, or responding. While someone called 911, I lowered the man to the patio. I remember thinking, I have someone in my arms who is dying, so I started CPR. I put both hands on the center of his chest and just started pushing, hard and fast. I kept doing chest compressions and breaths for about 2 minutes until medical help arrived. After medical help took over, I washed up, tied my apron on, and went back to serving coffee. But for the rest of my shift, I wondered how that customer was doing. Later, I found out he was a 66-year-old man named Mike. He survived his cardiac arrest and is doing well. I also found out that most people who witness a cardiac arrest either don't know CPR or are afraid to do it. So they call 911 and then they wait. Medical help gets there as fast as they can. But in the United States, it still takes an average of 4 to 10 minutes for them to reach someone in cardiac arrest. That means receiving CPR from a bystander is a person's best chance to survive until medical help arrives. It also means any CPR is better than no CPR. My career goal is to be in law enforcement and to do search and rescue. But you don't have to be a medical professional to help save a life. By learning hands-only CPR, you too can be ready to help someone in cardiac arrest. It might even be a friend or a family member whose life is in your hands. On your next coffee break, why not take the time to learn hands-only CPR?
Welcome to CPR and First Aid Anywhere, presented by the American Heart Association. Today, you'll learn some very important skills. You may not think you'll ever need to use these skills, but people just like you have saved lives with CPR. In this program, you're going to learn how to help save the life of an adult, a teen, or a child who needs cardiopulmonary resuscitation, also called CPR. Cardio means heart, and pulmonary means lungs. Cardiopulmonary resuscitation can help a person whose heart has stopped beating and pumping blood. Giving CPR and using an AED give a person in cardiac arrest the best chance of survival. AED stands for Automated External Defibrillator. If one is nearby, you should use it when you give CPR. The first method you're going to learn is called hands-only CPR, which means you only have to give compressions by pushing hard and fast in the center of the chest on the breastbone. You don't have to give breaths. After you've learned hands-only CPR, you'll have the option of learning CPR with breaths and choking relief for adults and children. Let's talk about how CPR saves lives and when a person needs it. Picture yourself giving someone hands-only CPR. The person is lying on the ground in front of you, and you're pushing hard and fast in the center of the person's chest. What is CPR doing to the body to help keep the person alive? Try to visualize how you think CPR is helping save this person's life. When you give compressions during CPR, you are acting like the heart, helping to push oxygen-filled blood to the brain and the rest of the body. This can help someone survive when his heart stops beating. You've probably heard the terms heart attack and cardiac arrest before. You might think a heart attack and cardiac arrest are the same thing, but they're not. In fact, there are some very important differences. The major difference between the two is that during a heart attack, the heart is still beating and pumping blood, and the person is still alive. When the heart stops beating, the person is in cardiac arrest. During cardiac arrest, the heart has stopped beating, and the person doesn't respond and isn't breathing normally. A heart attack occurs when a clot forms in a blood vessel carrying oxygen-rich blood to the heart muscle. When the heart doesn't get enough oxygen from the blood, the muscle starts to die. A person having a heart attack needs immediate medical treatment. If the blocked vessel isn't reopened quickly, the muscle normally nourished by that vessel begins to die. Typically, during a heart attack, the heart continues to pump blood, so the person doesn't need CPR. The longer the person with a heart attack goes without treatment, the greater the possible damage to the heart muscle. Occasionally, the damaged heart muscle triggers an abnormal rhythm that can lead to cardiac arrest. Heart rhythm refers to the sequence or pattern of heartbeats, whereas heart rate refers to the number of times the heart beats in a minute. Anytime the heart stops beating, it's called cardiac arrest. A heart attack isn't the only thing that might cause cardiac arrest. Problems such as severe injuries, drowning, and drug overdose can also cause cardiac arrest. Just remember, when a person's heart stops beating for any reason, that person needs CPR immediately. You might think cardiac arrest happens only to older adults, but the truth is, cardiac arrest can happen to anyone. It can happen to a young athlete, a family member of any age, or even a child or an infant. It's really scary to see someone whose heart has stopped beating. But if you phone 911 and start CPR immediately, you can help save that person's life. Don't be afraid of doing something wrong. This video will help you learn what to do so that you can give CPR and save a life. You just saw how a cardiac arrest can happen in a workplace. We're going to teach you exactly what to do. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the person on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the person doesn't respond, you need to get help. Shout to see if anyone is nearby. Say something like, "Help! Somebody help me!" If someone arrives, tell that person to phone 911 now and get an AED if one's nearby. If no one comes to help you, you will have to phone 911 yourself. If you have a mobile phone with you, phone 911. Use the speaker mode while you talk to the dispatcher so that you can have both hands free to start CPR immediately. If you don't have a mobile phone, leave the person to phone 911 and get an AED yourself. The dispatcher will ask you some important questions, such as, what's your exact location? So she can send help quickly and to the right place. If you're calling from a mobile phone, be very specific about your location so that medical help can find you easily. Don't hang up the phone unless the dispatcher tells you to. The dispatcher should help you remember and guide you through the steps of CPR and how to use an AED if one is available. Once you've called 911, you'll need to check if the person is breathing normally. Check for breathing for at least 5, but no more than 10 seconds. Look at the chest to see if it's rising as he breathes. If you see the person gasping, it's important to know that this isn't regular or normal breathing. A person who gasps usually appears to be drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. If a person who doesn't respond, isn't breathing normally, or is only gasping, it's a sign of cardiac arrest and the person needs CPR. We've just demonstrated the steps leading up to CPR. Now we want you to practice those steps. Use your mannequin to practice along with the video while thinking about how you would use these steps in real life. You have just found Minnie Ann lying on the ground. First, make sure the scene is safe. Next, tap and shout, "Hey, are you okay? Are you okay?" Shout for help and practice sending someone to phone 911 and get an AED. "Help! Somebody help me!" You, phone 911 now and get an AED. You're not going to actually practice phoning 911 yourself. Check for normal breathing. Check for breathing for at least 5, but no more than 10 seconds. Great job. Now you know how to do all of the steps leading up to CPR. In your lifetime, you may have to perform compressions on a real person, acting like the heart and helping to push oxygen-filled blood to the brain and the rest of the body. Your quick and confident action can help someone survive when his or her heart stops beating. We're going to teach you how to give high-quality compressions. Watch first, then you'll get a chance to practice. Before giving compressions, make sure the person is lying on a firm, flat surface like the floor. To give compressions, kneel beside the person's chest. Move the person's shirt out of the way so you can see where to put your hands. Put the heel of one hand in the center of the chest on top of the breastbone, and put your other hand on top of the first. Keep your hands in the center of the chest and push hard straight down. Make sure to push the chest down at least 2 inches. Push fast at a rate of 100 to 120 compressions per minute. Let the chest come back up completely after every compression. If you bend at the waist and keep your arms straight, you can use the weight of your upper body to compress deeply. Keep giving compressions until the AED arrives, medical help takes over, you physically can't continue, or the person starts to respond. It's time for you to practice compressions. Although we're just practicing today, you may need to use these skills in the future to save the life of a family member, a friend, or even a stranger. Put Minnie Ann on the floor and kneel beside her. Put one hand on the center of Minnie Ann's chest, and then put your other hand on top of the first. Keep your hands in the center of the chest and push straight down, hard enough that you can hear Minnie Ann click. Now, listen to this beat. The beat is telling you how fast to push. Compress to the beat. If you're pushing hard enough, you'll hear Minnie Ann click. Keep compressing to make sure that you know how hard you need to push. If you can't make Minnie Ann click, that's okay. Just push as hard as you can. Now you're ready to practice giving compressions. When the music begins, start pushing down hard in the center of Minnie Ann's chest, making sure you push the chest down at least 2 inches. You should hear the click each time you give a compression. Push fast at a rate of 100 to 120 compressions per minute, and let the chest come all the way back up after each compression. The music will help you practice pushing fast. Keep giving compressions until the music stops. Get ready to begin practicing compressions. Push down at least 2 inches. Listen for the click. Keep pushing hard and fast. Let the chest come all the way back up after each compression. Did you hear Minnie Ann click with every compression? If so, great job. That means you were pushing hard enough to keep blood moving through the body. This is one of the most important steps in hands-only CPR. Congratulations, you've learned how to give compressions. Now we're going to put all the skills we've learned so far together in sequence. Here's a scenario. You're at a farmer's market, shopping with friends, when a customer suddenly collapses. Use your mannequin and follow along with the video to practice all the steps you would do to perform hands-only CPR. First, make sure the scene is safe. Next, tap and shout. Hey, are you okay? Are you okay? If the person doesn't respond, shout for help. Help, somebody help me. Phone 911 and get an AED if one is available. You, phone 911 now and get an AED. Check for normal breathing. Begin compressions. You're going to practice giving compressions for 1 minute. Follow along with the beat. Push down at least 2 inches. Listen for the click. Let the chest come all the way back up after each compression. Keep giving compressions until the music stops. If you can't push hard enough to make Minnie Ann click, that's okay. Just keep pushing down hard on the chest and keep trying. In a real emergency, you'll give compressions until the AED arrives, medical help takes over, you physically can't continue, or the person starts to respond. Giving CPR right away increases the chance that a person will survive a cardiac arrest. You've learned that it's important to get an AED if one is nearby. Now, let's discuss why. An automated external defibrillator, or AED, can be used to treat cardiac arrest by delivering an electrical shock. An AED reads or analyzes the heart rhythm and then tells you if a shock is needed. Many airports, shopping malls, workplaces, and other public places now have AEDs you can use to treat cardiac arrest. If one is available, have someone phone 911 and bring you the AED. AEDs are often mounted on walls and have visible signs posted near them to help you locate them. By the end of this section, you'll be trained on how to use an AED. Using an AED is safe. It can't shock someone unless he or she really does need it. You only need to remember to turn it on and follow the prompts. Once you turn it on, the AED will tell you everything you need to do. Some AEDs will turn on automatically when you lift the lid. Others will require you to push the on button. After that, just follow the prompts you see and hear. Attach pads to the victim's bare chest. Some AEDs have both adult and child pads. For children 8 years of age and older, use the adult pads. Plug in pads connector. Analyzing heart rhythm. Pause to let the AED analyze. Loudly state clear and make sure that no one is touching the person. Shock needed. Loudly state clear and make sure that no one is touching the person. Then press the button to deliver a shock. Shock delivered. If an AED is available, use it. It's safe and easy, and it can increase the chance of survival for a person who is in cardiac arrest. If you send someone to get an AED, ask the person to use it immediately while you continue giving compressions. Tell the person to turn it on and follow the prompts. Here's your chance to practice using the AED simulators. Push the on button. Apply pads to victim's bare chest. Follow the diagrams on the pads to apply them to your mannequin's chest. Plug in pads connector. Analyzing heart rhythm. Pause to let the AED analyze. Loudly state clear. Shock needed. Loudly state clear and make sure that no one is touching the person before you press the shock button. Then press the button to deliver a shock. Shock delivered. Believe it or not, using a real AED is just as easy as using this one. All you have to do is turn it on and follow the prompts. In this course, we learn about using an AED on an adult or a child. When using an AED on a child, use the child pads if they're provided, or the child key or switch if the AED has one. If there are no child options, use the adult pads. Congratulations. You now know when and how to phone 911, how to give hands-only CPR, and how to use an AED for a teen or adult in cardiac arrest. Now that you know these life-saving skills, practice them often to stay sharp. Share these skills with your family and friends. The more people who know how to do hands-only CPR, the more likely it is that someone in cardiac arrest will survive. This video also includes information on adult CPR with breaths, how to help an adult who is choking, child CPR, and how to help a child who is choking. Thanks for watching and for learning how to help save a life. Many of us spend time around children, whether at our jobs, in our homes, or even in public places where children may be. And anyone could need CPR, even a child. Anytime a child is in trouble, our first instinct is to help. By the end of this section of the video, you'll know when and how to give CPR to a child and how to use an automated external defibrillator, or AED, on a child. Before we get started, let's talk about what we mean when we say child. For the purposes of giving CPR, a child is anyone older than 1 year, but not yet a teenager. If you're unsure of the child's age, treat anyone that looks like a teenager as an adult. Children usually have healthy hearts. Cardiac arrest in children often results from breathing problems, but it can also be caused by drowning, severe injury, poisoning, and other problems that cause low oxygen delivery to the body. For this reason, it's very important to give breaths with compressions when giving CPR to a child. When giving compressions to a child during CPR, you need to push the child's chest down about 2 inches, or at least 1/3 the depth of the chest. For a child, you can use 1 or 2 hands to give compressions. Use the number of hands necessary for you to push the child's chest down about 2 inches. Much of the rest of child CPR is the same as adult CPR. You need to make sure the child is on a firm, flat surface like the floor. You need to push fast at a rate of 100 to 120 compressions per minute and let the chest come back up completely after each compression. Let's say you're visiting a friend who has a 3-year-old child. The child stops breathing and needs CPR. We're going to show you what you would do. Many of the steps you learned in adult CPR will be the same in child CPR. Make sure the scene is safe. Tap and shout. Shout for help. Send someone to phone 911 and get an AED. Check for breathing and begin sets of 30 compressions and 2 breaths. If no one comes to help you and you don't have a mobile phone nearby, you need to begin sets of 30 compressions and 2 breaths. After 5 sets of compressions and breaths, if you're alone and no one has phoned 911, leave the child to phone 911 and get a nearby AED yourself. The key difference between adult and child CPR is that if you're alone, you stay with the child and give 5 sets of compressions and breaths before leaving to phone 911 and get an AED. Early CPR gives the child much needed oxygen immediately. Watch closely while we demonstrate the entire child CPR sequence. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the child on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the child doesn't respond, you need to get help. Shout to see if anyone is nearby. Say something like, "Help, somebody help me." If someone arrives, tell that person to phone 911 now and get an AED if it's nearby. If you have a mobile phone with you, phone 911 yourself. Use the speaker mode on your mobile phone so you can have both hands free to start CPR immediately. Remember to stay with the child. Check for breathing for at least 5, but no more than 10 seconds. Remember, if the child isn't breathing or is only gasping, it's a sign of cardiac arrest and the child needs CPR. Give sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if you're alone and no one has phoned 911, leave the child to phone 911 and get a nearby AED. Continue CPR until the AED arrives, medical help takes over, you physically can't continue, or the child starts to respond. Picture yourself at a shopping mall when a 6-year-old boy collapses in front of a store. His mother yells for you to phone 911 and get an AED while she begins CPR. Remember, when a child's heart stops beating, an automated external defibrillator, or AED, can be used to deliver a shock. You've already learned how easy it is to use an AED. You only need to remember to turn it on and follow the prompts. When using an AED on a child, use the child pads if they're provided, or the child key or switch if the AED has one. If there are no child options, use the adult pads. There are pictures on the child pads that show where to place them. When you put the pads on the child's chest, make sure they don't touch each other. AEDs are safe to use on children, and they could save a child's life. If a child needs CPR and there's an AED available, use it. Congratulations, you now know how to provide life-saving CPR to a child whose heart has stopped beating. You learned that child CPR is very similar to adult CPR with breaths. Just remember, if you're alone, you'll give 5 sets of compressions and breaths before you leave the child to phone 911 and get an AED. You also learned that using an AED is very similar for adults and children. Just remember to use the child pads if they're available. If you have access to an AED, use it as soon as possible. Now that you know these life-saving skills, practice them often to stay sharp. Share these skills with your family and friends. The more people who know how to do CPR, the more likely it is that someone in trouble will get the help that he needs.
Now we will move on to our first aid videos.
Now we're going to discuss common emergencies and what you can do while waiting for help to arrive. However, not all topics are covered in this video, so it's important to be aware of situations where you may need additional training. Topics we'll cover include how to recognize and help with bleeding and bandaging, stroke, heart attack, fainting, diabetes, seizures, and opioid overdose. Bleeding can quickly become life-threatening if not controlled. Severe bleeding occurs when a large blood vessel is cut or torn. When this happens, a person can lose a lot of blood within minutes. Minor bleeding occurs from small cuts or scrapes. Most bleeding can be stopped with pressure. It's important to stay calm. Bleeding often looks worse than it is. For minor cuts, wash the area with soap and water, and then apply a dressing to the wound. To stop severe bleeding, take the following first aid actions. First, send someone to get the first aid kit. While you are waiting for the first aid kit to arrive, have the injured person apply direct pressure to the wound. If gloves are in the first aid kit, use them. Once your gloves are on, apply dressings from the first aid kit and put direct pressure on the dressings over the bleeding area. Use the flat part of your fingers or the palm of your hand. If the bleeding doesn't stop, you'll need to add a second dressing and press harder. Do not remove a dressing once it's in place, because this could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. Once the bleeding has stopped, or if you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. But what if the cut is much deeper, and after you've applied pressure and dressings, the bleeding doesn't stop? The first aid kit may contain a pre-made or manufactured tourniquet, which consists of a strap that you wrap around the injured person's arm or leg and a straight stick-like object called a windlass. The windlass is used to tighten the tourniquet. If applied correctly, a tourniquet should stop the bleeding. If you don't have a tourniquet, you can make one. Fold a cloth or bandage so that it's long and at least 1 inch wide. Wrap the bandage 2 inches above the injury if possible. Tie the ends of the bandage around a small hand tool, stick, or something similar. Turn the item to tighten the tourniquet. Continue tightening until the bleeding stops. Stroke is another medical emergency for which you may need to use your first aid skills. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or leaks. Many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of stroke quickly and get medical care fast. You can use the FAST method, which is a simple way to remember the following warning signs of stroke. Face drooping. Does one side of the face droop or is it numb? Arm weakness. Is one arm weak or numb? Speech difficulty. Is speech slurred? And time to phone 911. If someone shows any of these symptoms, phone 911 immediately. If you see these signs and think someone is having a stroke, take these actions. First, phone or have someone phone 911. Next, note the time when the stroke signs first appeared. Remain with the person until help arrives. If the person becomes unresponsive and is not breathing normally or is only gasping, provide CPR. Earlier, we talked about the difference between a heart attack and cardiac arrest. When a person is in cardiac arrest, she needs CPR immediately. When a person has a heart attack, his heart is still beating and he needs a different kind of help. One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone 911. Ask someone to get the first aid kit and an AED if one is available, in case the person does go into cardiac arrest. Many first aid kits contain aspirin. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have him chew and swallow 1 adult or 2 low-dose aspirins. If the person becomes unresponsive and is not breathing normally, be prepared to provide CPR and use the AED. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery. Fainting may occur when someone stands without moving for a long time, especially if it's hot, has a heart condition, suddenly stands after squatting or bending down, or receives bad news. Fainting is a short period of time when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy and then becomes unresponsive but is still breathing. If you're asked to give first aid to a person who is dizzy but still responds, help the person lie flat on the floor. Seek medical help or phone 911 if the person doesn't improve or becomes unresponsive. If a person faints and then starts to respond, ask the person to continue to lie flat on the floor until he can sit up and feels normal. If the person fell, look for injuries caused by the fall. Seek medical help or phone 911. Signs of low blood sugar can come on quickly in someone with diabetes. Low blood sugar can occur if a person with diabetes has not eaten or is vomiting, has not eaten enough food for her level of activity, or has injected too much insulin. If low blood sugar occurs in a person with diabetes, the person may become irritable or confused, hungry, thirsty, or weak, sleepy, or sweaty, or the person might even have a seizure. If you suspect that someone has low blood sugar, take the following first aid actions. If the person can sit up and swallow, ask her to eat or drink something with sugar that can rapidly restore blood glucose levels. These items include glucose tablets, soft, chewy candy with sugar, orange juice, or whole milk. If the person can't sit up or swallow, don't force her. Have the person sit quietly or lie down. If the person does not improve within 15 minutes, phone or have someone phone 911. A seizure is abnormal electrical activity in the brain. Most seizures stop within a few minutes and are often caused by a medical condition known as epilepsy. But seizures can also be caused by head injury, low blood sugar, heat-related injury, poisoning, or sudden cardiac arrest. During a seizure, a person may lose muscle control, fall to the ground, or stop responding. And the person usually has jerking movements of the arms, legs, and sometimes other parts of the body. However, not all seizures look like this. Some people might have a glassy-eyed stare and not respond. During the seizure, a person may bite his tongue, cheek, or mouth. You can give first aid for that injury after the seizure is over. And after a seizure, it isn't unusual for the person to be slow to respond, be confused, or even fall asleep. The most important first aid action for a person having a seizure is to protect the person from injury. Move furniture or other objects out of the way and place a small pad or towel under the person's head. Contrary to myths you may have heard, if someone is having a seizure, you should never hold him down or put something in his mouth. Then phone 911. After a seizure, quickly check to see if the person is responsive and breathing. If the person is unresponsive and not breathing normally or is only gasping, provide CPR. Stay with the person until help arrives. If the person is having trouble breathing because of vomiting or fluids in his mouth, roll the person onto his side. Across the United States, far too many people are dying from drug overdoses. These deaths are largely due to opioids such as morphine, fentanyl, heroin, oxycodone, and hydrocodone. Opioid overdose can lead to cardiac arrest. That's why it's important for you to know how to respond to this life-threatening emergency. This section covers the special situation of known or suspected opioid overdose and the availability of naloxone. You are likely to encounter the person with the overdose in a home or isolated location where other equipment such as an AED is unlikely to be present. It's important that you know how to respond. There's a safe and effective way to help someone with an opioid overdose. Naloxone is a medication used to reverse the effects of an opioid and help the person to survive. If you know of someone who has been prescribed naloxone and you are familiar with or have been trained in the use of naloxone, you may use it to save a life. Common signs of opioid overdose include unresponsiveness with shallow or slow breathing, or even no breathing or only gasping. You may suspect opioid overdose if you see signs of the drug nearby or there is other evidence of drug use. If you suspect someone has overdosed on an opioid and the person is unresponsive but still breathing, shout for help, phone 911, and stay with the person until help arrives. If the person is unresponsive and not breathing normally, give 5 cycles of CPR with breaths and then phone 911 and get an AED if there is one nearby. After phoning 911, give naloxone right away and then assess the person's responsiveness. If the person is still unresponsive, continue CPR and use an AED if one is available. In situations where you suspect an opioid overdose, the American Heart Association recommends performing CPR with breaths, which is an optional module in this course.
Next, you will need to record yourself demonstrating hands-only CPR, just as they did in the video. When demonstrating CPR in your video, please make sure you complete these steps. Steps leading up to CPR: make sure the scene is safe. Tap and shout, "Are you okay?" Shout for help. Call 911 and get an AED if available. Check for breathing. Performing CPR. Before giving compressions, make sure the person is laying on a firm, flat surface, like the floor. Kneel on the floor beside the person's chest. Remove the person's shirt so you can see where you put your hands. Put the heel of one hand in the center of the chest on top of the breastbone and put your other hand on top of the first. Keep your hands in the center of the chest and push hard and straight down. Make sure to push the chest down at least 2 inches. Push fast at a rate of 100 to 120 compressions per minute. Let the chest come back up completely after each compression. Keep your arms straight and continue to give chest compressions until the AED arrives, medical help takes over, you physically cannot continue, or the person starts to respond. When you are done, once you have watched all of the video content for the course and you have recorded yourself demonstrating hands-only CPR, you will need to email that video to your CPR instructor. This is the same person who emailed you with this CPR course information. They will review your video for accuracy and forward your name to Mr. McGuire, our school's principal, to indicate you have met your CPR requirement for this year. If your demonstration video needs to be redone for any reason, for example, you didn't go through the steps for CPR, your hand placement was incorrect, etc., your CPR instructor will email you to let you know what needs to be corrected so you can try again. Please let him or her know if you have any questions or need any help. There is a specific deadline for completion of this course, so please make sure you follow all of your CPR instructors' deadlines closely.